Hi, my name is Jade Patel. I'm a licensed practical nurse and project director. Today, I will be presenting my project to initiate patient care whiteboards at North Country Hospital. All right, so the agenda for today, first we will address the needs, and as a whole, it is to improve communication and decrease mistakes related to patient care, specifically related to falls, aspiration, and spread of infectious disease. We will then go over the project description, the budget, and have a conclusion. So the first need that we will address is falls. Specifically ambulating patients in the hospital. Some patients are a 1 assist, some patients are a 2 assist, some require assistive devices like a walker or a cane. If you're not directly involved in the patient care, sometimes it's tricky to know whether they use a walker, and sometimes specifically elderly patients are very confused and unreliable. So as a nurse not caring for a patient, you can go into a room, they ask you to go to the bathroom, and they tell you that they can walk just fine, but then they get up and they're not able to walk fine, and that's when they have falls and injuries can occur from those falls. So in an article written in 2017, the author proposes the following. With more patient-centered interventions and more effective communication, falls will decrease in frequency and patient safety will increase. The second issue we will address is aspiration. So there is several diet orders when it comes to inpatients in the hospital. Some of these orders can include NPO orders, thickened liquids, pureed food, diabetic diet, clear liquid diet, high fiber, and low protein. These diet orders are put into effect sometimes when someone has trouble swallowing or when they have an upcoming procedure. And it's really important that we follow these orders because it can postpone procedure or it can put someone at risk for choking. Specifically, stroke patients after they've had a stroke, they can have trouble swallowing, and that's why they are put on thickened liquids or a pureed diet. So as a nurse going into a room, a patient can ask me for a cup of ginger ale, and if I am unaware that the patient is on thickened liquids and they are unable to express that, I can get them a drink and give it to them, and then they can aspirate and have a lot of medical issues due to that. So it's really important that we're following those diet orders and that those diet orders are communicated to everybody on the floor, not just the people taking care of that patient. So a quote, overall, we found that neither the documentation of nutritional treatment and care of elderly hospitalized patients nor the transfer of nutritional information between healthcare settings was sufficient. So these whiteboards are going to increase that communication and stop events like aspiration. Lastly, another need is spread of infectious disease. So infection control precautions include airborne, droplet, and contact. Several diseases require these precautions. For example, MRSA, C. diff, COVID-19. Diseases like that require precautions, and if those aren't communicated effectively, then healthcare workers can go into a room and they can pick up that disease and spread it to other patients or get it themselves. In an article from 2013, the author states ineffective communication of a patient's infectious status can result in non-compliance with infectious control precautions, exposing both staff members and other patients to the risk of infection. So on the next slide, I have some examples of infectious disease precautions. Contact precautions, that's what's used for C. diff and MRSA. And each precaution requires a different amount of personal protective equipment. So it's important that that PPE is available and that the precautions are posted. So contact precautions require gloves and a gown. Droplet precautions that can be used for specific types of pneumonia. You want to make sure that you have a mask and goggles. And airborne precautions require an N95 and additional PPE. So it's important that we're posting those. And with these whiteboards, we can post them on the whiteboards outside of the patient's room. And it's easy for other healthcare workers to identify that room as a precaution room and use the appropriate PPE. So what is it? What is the project? So the whiteboards will include information such as the nurse's name, the room number, the date, allergies, ambulation orders, fall risk, diet orders, etc., precautions like we just spoke about. And these will be posted outside of the patient's room. How does it work? So each nurse, as they begin their shift, they're going to fill out their patient's whiteboard with all the information that we just discussed. The nurse is also responsible for updating the whiteboard throughout the day with any updated information. So if a patient is on a regular diet at the beginning of the shift, but they're scheduled for a procedure the next day and the doctor wants them NPO, it's important to update that information. Or if a patient comes back positive for an infectious disease, it's important that we initiate those precautions and we have them posted outside the room so other healthcare workers on the floor are able to identify that and use their PPE to stop the spread of infectious disease. How does it solve the problem? So using these whiteboards will increase effective communication in the inpatient setting and decrease incidents such as falls. Staff on the floor, not directly involved in the patient care, will have fast access to simple orders. So this, instead of a coworker that's not caring for a patient, they ask for a drink, instead of going into the patient's chart and having to look through orders, find specific diet orders, it's all right there, so it's easily accessible. And along with myself and other healthcare workers, we know how busy things can get, and we don't always have the time to go into a patient's chart and look at orders. So this will increase communication without it being having us go out of the way to try to find this information. So this is the budget for my project. So $6,200, that's going to go toward the whiteboards, and those are customized with the information that I would like on each of them. $1,000 for staff training time. So each staff member will go into a course on why it is important to use these whiteboards, compliance, how to fill out the whiteboards, how to find markers and erasers if they're not with the whiteboard. $1,000 will go to staff maintenance time, so maintenance workers, time for them to go and post each whiteboard since they will need to be mounted on the wall. $110 for a bulk amount of Expo dry erase markers, and $160 for a bulk amount of Expo dry erasers. So this is my conclusion. The project will help decrease mistakes, increase patient safety, and increase patient satisfaction. Although this is a lengthy process that requires the support of all staff, it will improve inpatient experiences. It is my goal to help our community hospital become a more reputable facility. These are my references where I got information and quotes. And this is when I will allow time for questions. Thank you.